Nice to meet you all. I am GwangJun at KNRC. Can you turn to the next page? Today, I'm going to talk about how we have been responding to COVID-19 and what the challenges we have to face in the future. So let me introduce KNRC. So according to the law on the disaster and safety management organization, and we are providing relief on the emergency situations. On the occasion of disasters and emergency, we have a mandate to provide help to local communities and the government as well. And we have three categories of infectious diseases in terms of the level of alarming. And the government is supposed to set up a central quarantine response system, and KNRC is also participating in setting up such system. Like I said, as of on January 20, the first new case was reported, and the KNRC started running the emergency relief system. And on January 29th, the first death was reported due to COVID-19. So on January 23rd, the government actually upgraded the alarming level to severe or seriousness. According to the governmental response, we have been running the system as the COVID-19 is still widespreading. And you see this organizational chart. We have a Secretary General, and under them we have a daily relief activities and blood donation and international cooperation. So we have this organization working on various sectors at home and abroad. And in the past as well, this infectious disease is different from natural disasters. So within our organization, we were a little confused about how to respond to this new type of disaster. We have been very boasting of our volunteers, but we had to be very cautious about sending out our volunteers. So we have been providing and publishing the three versions of guidelines. The first one was released on February 25th in 2020, and we provided this to each branch. Like I said, on January, the alarming level was upgraded to seriousness. So those patients were not supposed to go out. So we found that they would have some difficulties in acquiring meals and beverages. So we sent out retro food to them. It was an emergency measure. And also within our organization, there are some possibilities to see some cases, new cases. But just in case that we would see new cases within our organization, we stored such relief supplies in different rooms, so that even when one supply was contaminated or infected, the others can be safe to be sent out. And the second guideline was released on March 4th. And we have seen some new cases or asymptomatic patients, and they were actually institutionalized in specific facilities, including, for example, the governmental facilities. As those patients will be living in strange places, we thought that they would need some daily supplies. So we also supported to those patients. And medical staff became very exhausted over time, as released by the media. So we were trying our best to help those medical staff, and we also investigated the demands of medical staff in hospitals nationwide. And the third guideline was released on May 6th in 2020. Even a month ago, the number of new cases was less than 10, and at least less than 50 with social distancing. So we realized that those with psychological problems or economic problems and financial problems, we released the guidelines to help them. For example, we provided support for vulnerable people in local communities, and at the same time, many of people in Korea will also have been struggling from some psychological problems, including depression. So we tried to help them. And at the same time, we are trying to provide life care. That life care is not confined to simply COVID-19 patients. Such help is also provided to other patients as well. And working on the activities of COVID-19 patients, we have been collecting some donations. The total collected amount is 4.3 Korean won, and out of them, 3.9 billion won was used. So the execution rate is 92.6%. And majority of the budget was spent on medical staff as well as small business owners as well. And the donated supplies reaches 3.8 billion won. One thing noteworthy is that these donations come from overseas countries as well. And such donated supplies were distributed to different sectors, including fire workers and medical staff, and as well as other workers. So 69 billion won were executed. 8.1 billion won were collected. Out of them, 6.9 billion won were used. And we are preparing ourselves for the possible second wave of COVID-19. And as part of the effort, we're collecting some PPEs and masks and other protective supplies to support medical staff once the second wave comes. And as you understand, Wuhan was the initial place spreading COVID-19. Since some of people asked us to help Wuhan, those in Wuhan. So with the help of other external organizations, we also received some donations from China as well, and the Korean nationals in Italy and Wuhan also helped us, and we actually sent out our supplies to those Korean nationals living in Italy and Wuhan, and also the members of KOICA and ASEAN policies, manpower development centers, and other governmental centers were used for such self-quarantine patients. And the people were under pressure and also depression sometimes. So we sent out some books to help them in psychological manners as well. We also sent out some stretching bands and some small exercise supplies. This is what we provided, facial masks. Over 12 billion facial masks were donated. So I would take this opportunity to thank those donators, contributors. And you see on the left-hand side, infectious disease response set. After MERS, we tried our best to prepare ourselves for another infectious disease. That time, we actually developed a pouch with thermometers and others. And, vulnerable people were not really able to purchase facial masks. So for them, we provided masks. And on the right-hand side is the household supplies set, which are used for those quarantined in government facilities. Children, women, and teenagers also received some children's safety sets. And also KNRC has been commissioned to run disaster management centers in 16 local communities, and we have many psychological counselors. They are professionals. As you know, the central government in charge of these activities is particularly for infectious diseases are the Ministry of Health and Welfare, and so those patients received some supplies from the ministry, but besides them, we believe that there should be some other people who are suffering because of this infectious disease, although it's not really direct impact. So we provide online counseling, and at the same time we are producing mental health care set. That's 5,000 units. So 5,000 units of mental health care set is produced. And at the same time, we provide counseling service as well as financial support to small business owners as well. And this is the summary page of the psychological support. We said we sent out some supplies to Wuhan in China, and 120,000 units of gloves, medical bed sheets were sent. And at the same time, 400,000 units of goggles and masks and clinical thermometers were sent to China. And our activities became an example, was actually designated as a good example of for the international community. So we also had a video conference with a Canadian organization. And in Seoul, Sangsu, 통영, and Yeongju, we have designated hospitals on COVID-19, and we also help them. And these hospitals are Red Cross hospitals. These are screening centers. We separate clean zones from contaminated zones to make sure other patients are not infected by COVID-19. And this is in relation to blood service. With the COVID-19 outbreaks, the blood section hit hardest. Teenagers, the blood donation was the largest portion in blood donation, but we couldn't really receive any blood from them with the COVID-19 outbreaks. So we asked others, grown-ups in specific sectors, including public sectors, to donate their blood. Well, so we have 5-day reserves for blood. That's our standard, and now we have 4-day reserves, but which is sufficient thanks to the help of people in Korea. This is other activities. You may refer to these photos. And among vulnerable groups of people, including immigrant workers, they cannot really afford to purchase masks. So we help them in discussion with the relevant agencies of the government, and these are challenges. Unlike the disasters that we went through, COVID-19 requires something new. New approaches. Caterings and text message alarming were not enough. And volunteers' activities were quite limited in COVID-19 because we don't know what COVID-19 is about indeed and how it can be solved. So we have to think further about how we can respond to COVID-19 and make a full use of our volunteers and our activities. We may need some professional activities to help them. In preparation of the second wave of COVID-19, we are planning to establish a quarantine professional system in collaboration with a Korean disaster quarantine agency. And also we would like to take advantage of ICT. Well, the refugee camps of victims of disasters, these are sort of support, and to help them, we have to make a research, conduct a research about their specific needs. And for us, the definition of disaster victims are those who lost their families and their assets. But at this moment today, as for COVID-19, everybody can be a victim. And medical staff is also a victim. This is very unprecedented. So we have to have them all, even medical staff. The majority of people asked us to help medical staff, and they donated themselves. They donated some supplies and capital to us to help medical staff. and unchecked activities became a new normal nowadays, and trainings for volunteers and general people and teachers will be proceeded online. So perhaps next January, people will receive our online training. And third, we think that we have to educate the public as a whole. First aid activity should be done to cardiovascular disease patients. Just like that, we also think psychological support is needed for those who are suffering due to a sudden attacks or of disease. We planned to do so, but due to COVID-19, we were not able to do that as planned, so we are going to do that. And this is a very interesting result of surveys. 30% of general people said that the patient of COVID-19 is responsible for their infection. And those with COVID-19 infection said that they were so much worried about social stigma rather than recurrence of the virus. So let's say you have a COVID-19 patient in your neighborhood or in your surroundings, you shouldn't give any stigma to them. So we have to raise awareness of improving the recognition and perception toward COVID-19 patients. Last but not least, we have to establish the collaboration between private and public sectors. As you know, due to privacy, the private sector have a limitation to access the data to figure out exact numbers. For example, like the number of asymptomatic patients. In the meantime, the government has that access, but they are short on supplies and manpower. So we need an organic collaboration and cooperative system between private and public sectors. So we need a sort of model for such collaboration. Where such an effort was made through some sessions hosted by the Ministry of Administration and Local Affairs. For what, to whom, and how can donations be used after KNRC collected such donations? And how do manage such donations? Should be also shared. I mean, such information should be shared to the private sector. If so, then we can develop and make a progress in relief system in Korea. And at the same time, for masks, we were able to collect masks, but we're not able to actually purchase masks because we set up an emergent system, a purchasing system for masks. Only the public mask was sold during a specific period of time. That time we were not able to send out such masks to those in need. We just sent out the masks donated by people. So the government has to take that into account. Or maybe the government themselves have had to provide masks to those vulnerable groups of people. And for blood donation, on the occasion of the national disaster crisis, some sub-agencies and the Ministry of the Health and Welfare, as well as the Ministry of Planning and Finance, and other government agencies have to be prepared with plans, with a preemptive plans. And Also, for hospitals, depending on how the hospitals belong to private or public or local communities or municipalities, how to help patients can be different. But anyway, such private hospitals which treated patients were discriminated by the government at the very beginning of this crisis. Last but not least, I would like to emphasize that we work together to overcome the disaster. Thank you.